Hello, welcome to the American Ambulance Ventway Sparrow ALS ventilator call walkthrough. When you are dispatched on an ALS ventilator call, the first thing you will need to do is pick up a ventilator at either Fresno HQ or Hanford HQ. There will be 3 ventilators at Fresno HQ and 1 ventilator at Hanford HQ. You will also need to grab a backpack that will have extra supplies that you may need during the call. If the battery is low, get a different ventilator or charge the ventilator on the way to the call. Once you pick up the ventilator, open the box and ensure that you have 1 adult circuit, 1 pediatric circuit, 2 HME bacterial filters, the oxygen blender, the test lung, the high pressure oxygen tubing, the Ventway Sparrow, and the charging cord. When you arrive on scene, take the following pieces of equipment with you to the patient's bedside: the Zoll monitor, the oxygen bag, the Ventway Sparrow, the proper circuit, the test lung, the high pressure O2 line, the oxygen blender, and the filter. When you arrive at patient bedside, get the turnover report from the nurse and get the vent settings from the RT, and perform your initial patient assessment. You should be getting a full set of vital signs, assessing lung sounds, assessing the ET tube if present, tube depth, and make sure it's secure. And if there is a BVM available at bedside, grab that as well. After assessing the patient and getting the ventilator settings from the RT, it's time to turn on and set up the ventilator. Press the power button to turn on the ventilator. Remove the circuit from the bag and remove the blue cap. Plug in the circuit and plug in the sensor tubing. After it's plugged in, perform the circuit test by pushing the button. After completing the circuit test, select either adult or pediatric, select the patient's ideal body weight, and select the proper ventilation mode. After the initial setup, change the ventilator settings to match the hospital settings. Change the breaths per minute to 16 and the tidal volume to 350. The last step is to hook up the oxygen. Plug in the oxygen blender into the back of the vent and secure it with 2 turns. Plug in the high pressure oxygen tubing to the oxygen blender. Adjust the FiO2 to 60%. On the ventilator screen, navigate to the menu, select vent parameters, select FiO2 correlation, and adjust to 60%. After adjusting the FiO2, connect the circuit to the test lung, start the ventilator, and adjust the PEEP using the PEEP valve on the circuit. Grab some extra hands if needed and move the patient over onto our gurney. The patient will still be on the hospital ventilator during this move. On our gurney, hook up the cardiac monitor, the blood pressure cuff, the end-tidal CO2, and the SpO2 sensor. Every time you move the patient, perform an airway confirmation. Check lung sounds, tube depth, and assess end-tidal CO2. Connect the high-pressure oxygen tube to your oxygen source, press the start button, and connect the vent circuit with the end-tidal CO2 and HME filter to the patient. While still at patient bedside, give the patient 3 to 5 minutes to adjust to the ventilator. Utilize the RT if needed to make any necessary adjustments. While in the ambulance, switch the oxygen over to the main O2. Now, reassess your patient, starting with lung sounds. Also check tube depth and end-tidal CO2 reading. You should be reassessing your patient's vital signs a minimum of every 15 minutes. At the receiving facility, move the patient over to the receiving facility's bed. Give a turnover report, do one last airway confirmation, and when the RT is ready, switch the patient over to the facility's ventilator. Turn off your ventilator, clean it, and put it away.